Injection facilities. Here's Wendy Saltzman with more.
The opioid crisis is being treated as the largest public health epidemic since AIDS and has become more deadly. Now Philadelphia officials have been quietly investigating the controversial idea of becoming the first city in the United States to open safe injection sites in our hardest hit neighborhoods.
There you go. Come on back.
This is a day in the life of an addict in Kensington. Drug abusers seconds away from death. Needles litter city streets. Users getting high on the side of a busy road.
Beginning of this year, I overdosed, but they brought me back.
Others aren't as lucky.
We want to save lives.
The magnitude of the heroin crisis has public health officials and law enforcement grasping for ideas and exploring highly contentious solutions.
I totally understand people being uncomfortable with it.
Including creating facilities where drug users can inject themselves with illegal drugs, seemingly with the permission of local municipalities.
Do you think that that would work here in Philadelphia?
Again, this is something we're looking into. We know from other centers that it saved lives. But it's complicated from a community perspective, it's complicated from a legal perspective.
Philadelphia's Health Commissioner Dr. Tom Farley sat down for a one-on-one interview with Action News to discuss a trip he and other local officials took to Canada to investigate their safe injection program.
People can come in and they sit down at a little booth, they have access to syringes and other sterile equipment. They inject drugs.
In Vancouver, the injection sites are based in neighborhoods already plagued by the drug epidemic. The idea to keep users off the streets. They're supervised by staff who can give them Narcan if they overdose and who can talk addicts into a recovery program just a few feet away.
There is evidence that these facilities do increase the number of people who go into drug treatment.
But critics say it allows people to engage in illegal activity in facilities funded by taxpayers.
The public is paying a lot for this crisis right now with all of the consequences, and we're paying not just in dollars, we're paying in our lives.
Top enforcement officials like Philadelphia District Attorney Larry Krasner.
I will not enforce against safe injection sites that are properly run.
And Atlantic County DA Damon Tyner.
People and attitudes are starting to change towards how we're going to treat this epidemic.
Say this crisis may need to be approached as a public health issue and illness, not a crime.
I don't think the user should be put in jail, absolutely not.
Farley says there is evidence safe injection sites reduce the number of people injecting themselves in public, the number of needles on the ground, and public disorder related to drug use. Most importantly, he says, is keeping addicts alive.
If this were your son or daughter and you did everything you could to get them into drug treatment, you would also want to at least keep them alive until they were ready.
Dr. Farley says Philadelphia officials may decide as early as this month if they want to move forward with a safe injection site. In Vancouver, they say for the 10 years the site has been open, they have not had a single death at the facility.